The real problems are mostly hepatitis B and hepatitis C, because both of them, first of all, are very common around the world. We are talking about hundreds of millions of people here.
Monday marks World Hepatitis Day, and in 2016, Canada had pledged to support the World Health Organization's campaign to eliminate the disease by 2030. Though Montreal Jewish General Hospital Chief of Infectious Diseases, Dr. Karl Weiss, says that won't happen unless something changes in Quebec.
We're not going to eliminate hepatitis B and C, I think, because the number of people who are affected by the disease are so high around the world that it would be very difficult.
Hepatitis is an inflammation of the liver that is caused by a variety of infectious viruses and non-infectious agents, leading to a range of health problems, including severe liver damage and cancer, some of which can be fatal. There are a variety of different types of the disease labeled A, B, C, D, E, with the most common ones being type A or B.
They're both either, I would say, treatable or curable. The difference being that for hepatitis B, you rarely cure hepatitis B, but you can control the disease. And for hepatitis C, with the tools we have today, we can cure the disease.
Dr. Weiss says carrying the disease varies case by case, and it can be picked up when visiting a different country or a high-risk area. Acquiring type B and C is mostly through IV drug use or by sexual contact. In 2021, Quebec reported 805 cases of hepatitis C, representing 10.7% of all reported cases in Canada. In an email statement to City News, Action Hepatitis Canada says an estimated 24 people die in Canada each week due to hepatitis B or C, calling it a policy failure. Executive Director of Action Hepatitis Canada, Jennifer Von Gennep, says, "With the data we have, it appears that most Canadian provinces and territories are still on track to eliminate hepatitis C as a public health threat by 2030. However, Ontario, Quebec, and Manitoba still are not, and that accounts for a large portion of the impacted population."
And when we are today in 2025, and you look at this prediction, obviously we're not there. So it's very difficult to make prediction like this. I think it's better to have like a strategy to try to promote, for example, the hepatitis B vaccine around the world.
Dr. Weiss says immunization is needed, noting how current research shows timely elimination would save hundreds of lives and over $122 million in direct medical costs.
The risk of dying and complication is very high, so the importance right now is more screening and taking care of these people.
In Montreal, Tehosterihens Deer, City News.